The variant was already spreading when the email arrived. Subject line: New lineage detected. Sender: Johannesburg. Date: November 2021. Health officials in London and Washington opened it the same hour and realized South Africa had just beaten them by days, maybe weeks. Not with more money, not with bigger labs, with something else entirely. And suddenly, the people who'd spent decades writing the rule book on global disease surveillance were asking a country they'd overlooked one very uncomfortable question. How did you see this before we did?
November 24th, 2021, 9:47 p.m. Johannesburg, South Africa. Dr. Tulio de Oliveira stares at his computer screen, the glow illuminating his face in the dimly lit lab. His eyes scan the data one more time. Then again, the phylogenetic tree on his monitor shows something that shouldn't exist yet. A variant with more than 30 mutations on the spike protein alone. His hand hovers over the keyboard. He knows what this means. In less than 12 hours, this information will send shockwaves through every major health organization on the planet. The World Health Organization will convene emergency meetings. Travel bans will be announced. Stock markets will plunge. But right now, in this moment, only a handful of scientists in South Africa know what's coming. This is Omicron. But this story isn't really about Omicron. It's about how a network of scientists in South Africa built something the world's richest nations couldn't. A genomic surveillance system so sophisticated, so fast, that it detected threats before they appeared on anyone else's radar. While Europe and North America were still catching their breath from Delta, South African labs were already sequencing the future. The world had underestimated Africa again. What they didn't know was that South Africa had been quietly preparing for this moment for years. Not because they had unlimited funding, not because they had the latest equipment shipped from Boston or Berlin, but because they had something more valuable: brilliant minds, collaborative networks, and the hard-earned knowledge that when a pandemic hits, you can't wait for someone else to save you. You have to save yourself. De Oliveira picks up his phone. He needs to make calls, lots of them. But first, he looks back at the screen one more time. The data is clear, undeniable, terrifying. This variant is spreading faster than anything they've seen. It's already in multiple provinces. It's probably already on planes heading to other continents. The race is about to begin. But here's what the world didn't understand yet. South Africa wasn't behind in this race. They were ahead, miles ahead. And the story of how they got there is one of the most remarkable scientific achievements of the 21st century. It's a story of innovation born from necessity, of networks built on trust rather than funding, of scientists who refused to accept that Africa would always be last to know. This is the story of how African scientists changed the rules of pandemic response forever.
Rewind to March 2020. The pandemic is just beginning. In Geneva, the World Health Organization is scrambling. In Atlanta, the CDC is overwhelmed. In London, scientists at Imperial College are building models, trying to predict what's coming. Everyone is flying blind. Testing is chaotic. Data is scattered. Nobody really knows how many variants exist or where they're spreading. But in South Africa, something different is happening. Dr. de Oliveira, along with researchers at the Network for Genomic Surveillance in South Africa, NGSAS for short, are building something unprecedented. Not a single lab, not a government program, a network. 8 major laboratories across the country, connected by shared protocols, shared data, and shared urgency. They're not waiting for international organizations to tell them what to do. They're not waiting for funding that might never come. They're moving. Professor Penny Moore at the National Institute for Communicable Diseases in Johannesburg is sequencing samples as fast as they arrive. Professor Wolfgang Prieser at Stellenbosch University is refining techniques to extract clearer genetic data from limited samples. Dr. Anne van Gotberg is coordinating with public health officials, making sure the data translates into action. Each lab plays a role. Each scientist brings expertise the others need. They share everything: techniques, data, insights, failures. There's no competition here, no territorialism, just a shared understanding that speed and accuracy will save lives. And they're fast, impossibly fast. While other countries are taking weeks to sequence samples and identify variants, South African labs are doing it in days, sometimes hours. They're not using magic, they're using efficiency, collaboration, and sheer determination. Every sample that comes in gets prioritized. Every sequence gets analyzed immediately. Every finding gets shared across the network instantly. By late 2020, this system is humming. It's not perfect. Funding is tight, equipment breaks down, staff are exhausted, but it works. More importantly, it's producing data that's as good as anything coming out of Cambridge or Stanford. Better in many cases, because it's faster and more representative of what's actually circulating in communities. The global scientific community is starting to notice. When South Africa identifies the beta variant in December 2020, another heavily mutated strain that evades some immune responses, the speed of the discovery stuns international researchers. How did they find it so quickly? How did they sequence it so thoroughly? How did they confirm it was spreading before anyone else even knew it existed? The answer is simple. They built a system designed for exactly this moment. But the world still doesn't fully appreciate what South Africa has created. Not yet. That realization is coming. And it's coming fast. Because in the Gauteng province and samples collected from a clinic in Tshwane, something new is emerging. Something that will force the entire world to pay attention to what African scientists have been doing all along.
November 23rd, 2021, one day before de Oliveira's late-night discovery. The samples are routine at first, just another batch from the Gauteng province where Johannesburg and Pretoria sit. But when the sequences start coming back, the scientists notice something odd. The samples aren't matching known variants. They are not matching anything in the global databases. Dr. Sikulile Moyo, a researcher at the Botswana Harvard AIDS Institute Partnership, is seeing similar patterns in samples from Botswana. He's in contact with the South African team. The sequences are almost identical. This isn't a local mutation, it's spreading fast. By the evening of November 24th, the team has enough data to be certain. This is a new variant and it's unlike anything they've seen. More than 50 mutations compared to the original Wuhan strain. 32 on the spike protein alone, the part of the virus that attaches to human cells. Some of these mutations are known to increase transmissibility. Others help the virus evade antibodies. Several have never been observed before. De Oliveira knows the protocol. He needs to inform the South African Department of Health. They need to inform the World Health Organization. This needs to happen fast, but it needs to happen right. The data needs to be solid. The analysis needs to be clear. Because once they release this information, everything changes. At 11 p.m., de Oliveira sends the alert. By 6 a.m. on November 25th, the South African government holds a press conference. Minister of Health Dr. Joe Phahala stands before cameras and tells the world, South Africa has identified a new variant of concern.
It has an unprecedented number of mutations. It appears to be spreading rapidly in Gauteng province. The scientific community has designated it B.1.1.529. The World Health Organization moves faster than it ever has before. Within hours, they convene an emergency meeting. By the end of the day, they've given the variant a name from the Greek alphabet, Omicron. They've designated it a variant of concern, the highest alert level. Global reaction is immediate and severe. The United Kingdom bans flights from South Africa and 5 neighboring countries. The European Union follows, then the United States, then dozens of other nations. Within 48 hours, Southern Africa is essentially cut off from the world. Stock markets plummet, headlines scream warnings. Scientists around the world scramble to understand what South Africa has just identified. But here's the thing nobody is talking about in those first chaotic days. South Africa didn't create Omicron, they discovered it. And they discovered it because they had the systems, the expertise, and the speed to detect what others would have missed for weeks, maybe months. While the world panicked, South African scientists went back to work. They had more questions to answer. How transmissible is Omicron really? Does it cause more severe disease? How well do vaccines work against it? The data would determine how the world should respond. And once again, South Africa would have the answers. But the travel ban stung. After doing everything right, after building a world-class surveillance system, after sharing data immediately and transparently, after warning the world as fast as humanly possible, South Africa was being punished, cut off, isolated. It was a bitter reminder of how the world still saw Africa as a source of problems, not solutions, as a place to be feared and avoided, not learned from and supported. The scientists kept working anyway, because that's what they'd been doing all along. To understand how South Africa got here, you have to go back further. Back before the pandemic. Back to the decisions that made this moment possible. In many wealthy nations, genomic surveillance was something that happened in prestigious university labs funded by massive government grants, supported by infrastructure built over decades. It was reliable because it was established. Slow sometimes, but reliable. South Africa didn't have that luxury. What they had was experience with HIV, decades of it. South Africa has carried one of the world's heaviest HIV burdens since the 1990s. At the pandemic's peak, more than 7 million people were living with HIV in South Africa. The disease had devastated communities, strained health systems, and forced the country to develop expertise in virology, immunology, and infectious disease tracking that few other nations could match. That expertise didn't come easy. It came from loss, from watching entire generations affected, from building clinics in rural areas where none existed, from training scientists who stayed and fought instead of leaving for better funded labs overseas. When COVID-19 hit, South Africa didn't have to start from scratch. The infrastructure was different. HIV and coronavirus are nothing alike, but the knowledge base was there. The networks were there. The determination was there. Dr. De Oliveira himself had built his career studying HIV evolution and drug resistance. Professor Penny Moore was an expert in how viruses mutate to escape immune responses. Professor Pricer had spent years refining laboratory techniques that could extract maximum information from minimal samples, crucial in a country where resources are always tight. These weren't scientists who learned virology from textbooks alone. They learned it from watching viruses evolve in real time, in real communities, with real consequences. They understood that every day of delay meant lives lost. They understood that precision mattered, but so did speed. So when COVID-19 arrived, they adapted fast. They took protocols used for HIV surveillance and modified them for coronavirus. They took collaborative networks built to fight AIDS and repurposed them for pandemic response. They took laboratory techniques refined over years of resource constraints and applied them to a global emergency. And they did something else, something that would prove crucial. They made data sharing a core principle from day one. Every sequence went into global databases immediately. Every finding was published and shared with the international scientific community as soon as it was verified. There was no hoarding of data, no waiting to publish in prestigious journals first, no strategic delays to gain competitive advantage. Why? Because that's not how you fight a pandemic. You fight it by giving everyone the information they need as fast as possible. This philosophy, this commitment to radical transparency was baked into the NGSSA network from the beginning. It came from years of working with international HIV researchers who understood that viruses don't respect borders or prestige. It came from knowing that in Africa, you often survive by collaborating, not competing. By mid-2021, South Africa was sequencing a higher percentage of its COVID cases than most European countries. Think about that. A country with a GDP per capita that's a fraction of Germany or France was doing better genomic surveillance than the economic powerhouses of Europe. How? Smart allocation of resources, prioritization of what mattered most, scientists who are willing to work brutal hours because they knew what was at stake, and a network that valued speed and sharing over individual recognition. The system wasn't perfect. Labs sometimes ran out of reagents. Equipment broke down and repairs took weeks. Staff burned out and had to be replaced. Funding was always a challenge. International grants were available, but they came with bureaucracy and delays. But the system worked, and when Omicron emerged, it proved just how well it worked. December 2021. The world is in panic mode over Omicron. News outlets run endless speculation. Is it more deadly? Will vaccines work? Should we lock down again? Politicians give press conferences full of caution and concern. The public is exhausted, scared, and confused. But in South Africa, scientists are doing what they do best, gathering data. Dr. De Oliveira and his team aren't just sequencing Omicron samples. They are tracking its spread in real time, analyzing hospitalization rates, studying breakthrough infections in vaccinated individuals, and collaborating with clinical researchers to understand disease severity. The early data is puzzling. Omicron is spreading incredibly fast, faster than Delta, faster than anything they've seen. Within 3 weeks, it becomes the dominant variant in Gauteng province, overwhelming Delta completely. This level of transmissibility is unprecedented. But something else is happening, something unexpected. Hospital admissions are rising, but not the way they did with previous waves. The patients coming in are less severely ill. Fewer are needing ICU care. Fewer are dying. In a hospital in Tshwane, Dr. Farid Abdullah is treating Omicron patients and noticing that many have milder symptoms than Delta patients had. Shorter hospital stays, less oxygen needed, better outcomes. Is Omicron less severe, or is this just because South Africa's population has more immunity from previous infections and vaccination? The scientists know the world needs answers, and they are going to provide them. By mid-December, the data is clear enough to share. Dr. De Oliveira, along with researchers from the National Institute for Communicable Diseases and several major hospitals, published preliminary findings. Omicron appears to cause less severe disease than Delta. Vaccines still provide significant protection against severe outcomes, even if they are less effective at preventing infection.
This is crucial information, game-changing information. The world has been preparing for a variant that's both more transmissible and more deadly. But the data from South Africa suggests that's not what Omicron is. It spreads faster, but it's less dangerous, especially to vaccinated and previously infected people. Global health agencies scrambled to verify these findings. Labs in the UK, the US, and across Europe begin their own studies. Within weeks, the data from South Africa is confirmed. Omicron is indeed less severe. The panic begins to subside, not because Omicron isn't serious. It still hospitalizes and kills people, still overwhelms health systems with sheer volume of cases, but because the data shows it's not the catastrophic threat many feared. And that data came from South Africa first, weeks before anyone else had enough cases to analyze, weeks before wealthier nations with more resources could provide similar insights. The travel bans by this point look foolish, cruel even. South Africa did everything right, detected the variant early, shared data immediately, provided crucial insights about severity, and got punished with isolation. Meanwhile, Omicron was already spreading globally before the first travel ban was even announced. The restrictions didn't stop the variant, they just hurt South African tourism and economy during the crucial holiday season. But the scientists weren't focused on politics or fairness. They were focused on the work. Professor Pennymore's team was studying Omicron's ability to evade antibodies. Professor Preiser was tracking how the variant was evolving as it spread. Dr. von Gottberg was coordinating with public health officials to ensure hospitals had the information they needed. The network that South Africa built kept producing insights throughout the Omicron wave, not just about the variant itself, but about population immunity, about the effectiveness of different vaccines, about which interventions worked and which didn't. And they kept sharing everything, every dataset, every analysis, because that's what the NGS-SA network was built to do.
By early 2022, the global scientific community fully understands what happened. South Africa didn't just detect Omicron, they changed how the world thinks about genomic surveillance. They proved that cutting-edge science doesn't require cutting-edge budgets. They showed that collaboration can beat competition. They demonstrated that Africa isn't just a place where diseases emerge, it's a place where solutions are created. The recognition comes slowly, then all at once. Dr. Tulio de Oliveira is invited to present at international conferences. The NGS-SA network becomes a model studied by other countries trying to build their own surveillance systems. Research papers cite South Africa's response as exemplary. The scientists who spent years building the network, who worked through the night during the Omicron discovery, who shared data while their country was being isolated, they are finally getting the credit they deserve. But more importantly, the system they built keeps working. When new Omicron subvariants emerge, South Africa detects them quickly. When patterns shift in hospitalizations or infections, the network provides data to understand why. The infrastructure that proved itself during Omicron becomes a permanent asset, not just for South Africa, but for the entire continent. Other African nations take notice. Nigeria, Kenya, Uganda, and others begin strengthening their own genomic surveillance capabilities, often with guidance from South African scientists. The Africa CDC, the African Union's public health agency, invests in expanding surveillance networks across the continent. What South Africa proved possible inspires a continental transformation. This is bigger than COVID. This is about changing the narrative. For too long, Africa has been portrayed as a passive recipient of global health interventions, a place where diseases happen and where solutions come from elsewhere,
a continent perpetually behind, perpetually dependent, perpetually waiting for help. South Africa's COVID surveillance network shattered that narrative. It showed the world that African scientists can be leaders, not followers. That African institutions can set standards, not just meet them. That African innovation can emerge from necessity and excel through determination. The scientists themselves remain humble. In interviews, Dr. De Oliveira credits the team, the network, the collaborative spirit. Professor Moore emphasizes how much they learned from international partners. Professor Praiser talks about the challenges they still face, the funding gaps that remain, the work still to be done. But behind the humility is a quiet pride. They know what they built, they know what they proved, they know that when the world needed answers, South Africa delivered. And they know that future pandemics, because there will be future pandemics, will be fought with the tools and techniques they helped pioneer. The travel bans left scars, the isolation hurt. The sense that doing everything right still resulted in punishment, that stings. But it also hardened resolve. It reinforced the understanding that Africa cannot wait for the world to treat it fairly. It must build its own capabilities, strengthen its own institutions, trust its own scientists. That's exactly what South Africa did. And when the next global health emergency comes, the world will be watching Africa not as a source of concern, but as a source of solutions. Because that's what African excellence looks like.
Let's sit with this for a moment. Let's understand what really happened here. A network of scientists in South Africa, working with limited budgets and aging equipment, built a genomic surveillance system that outperformed those in countries with 10 times the resources. They detected variants before the CDC, before the European Center for Disease Prevention and Control, before the most prestigious labs in London, Boston, and Tokyo. This wasn't luck. This was skill, determination, and a refusal to accept second best. Think about what it takes to build something like this in a country where the median income is $6,000 a year, where load shedding, rolling power blackouts can shut down a lab's freezers and ruin precious samples, where international suppliers often prioritize wealthy nations when reagents and equipment are in short supply. Think about the scientists who could have taken jobs overseas, who get recruited constantly by European and American universities offering higher salaries and better facilities, but who chose to stay, who chose to build something where it was needed most. Dr. De Oliveira could be running a lab at Harvard or Stanford. Professor Moore could be at Oxford. Professor Praiser could be anywhere in Germany. They are that good, internationally recognized, published in the most prestigious journals, cited by thousands of other researchers. But they stayed because the work mattered more than the prestige, because South Africa needed them more than Boston or Berlin did, because building capacity in Africa was more important than building careers in Europe. This is the part of the story that often gets missed. The personal sacrifice, the choice to stay when living would be easier, the determination to build something lasting rather than something comfortable. And it's not just the senior scientists, it's the lab technicians who process hundreds of samples a week, the graduate students who analyze sequences late into the night, the administrative staff who coordinate between labs, chase down funding, and keep the network running. It's the entire ecosystem of people who looked at a global pandemic and decided we're not waiting for someone else to save us. We're going to save ourselves. And while we're at it, we're going to save everyone else too by sharing what we learn. That's the spirit that built the NGSSA network. That's the spirit that detected Omicron. That's the spirit that's now inspiring the next generation of African scientists. In universities across South Africa, at Wits, at Stellenbosch, at Cape Town, at KwaZulu-Natal, students are choosing genomics and virology as their field of study because they saw what's possible. They saw African scientists making discoveries that matter globally. They saw that you don't have to leave Africa to do world-class science. This is how you change a continent.
not just with one discovery, but by inspiring hundreds, thousands of young people to see themselves as scientists, as innovators, as problem solvers, by showing them that the tools of modern science can be mastered anywhere, that excellence isn't geography dependent, that African solutions to African problems often turn out to be global solutions to global problems. The South African COVID surveillance network is training the next generation. They're developing protocols that other countries adopt. They're building partnerships that strengthen science across the continent. They're proving that investment in African research capacity isn't charity, it's smart global health strategy. Because when the next pandemic comes, when H5N1 jumps to humans, or when a new coronavirus emerges, or when some pathogen we haven't even heard of yet starts spreading, the world will need what South Africa built: the speed, the accuracy, the transparency, the collaborative networks that share data instead of hoarding it. That infrastructure exists now because South African scientists refuse to wait, refuse to accept that Africa would always be last to know, last to respond, last to contribute. They built something that proved otherwise, something that will outlast COVID-19, something that's changing what's possible for African science.
The Omicron story forced a reckoning, a realization that couldn't be ignored. For decades, global health followed a predictable pattern. Diseases emerge in the global south, solutions come from the global north. Rich countries develop the vaccines, the treatments, the diagnostic tests. Poor countries wait to receive them. Knowledge flows one direction, resources flow one direction, credit flows one direction. COVID-19 was supposed to be different, but in many ways it followed the same pattern. The vaccines came from Pfizer, Moderna, AstraZeneca, companies headquartered in New York, Cambridge, Massachusetts, and Cambridge, England. The early genomic analysis that identified SARS-CoV-2 came from China, but then from labs in Seattle and Sydney. The treatments, the testing systems, the public health strategies, most originated in wealthy nations. Then South Africa detected Omicron and the pattern broke. Here was cutting-edge science, genomic surveillance happening at a speed and scale that most wealthy nations couldn't match, coming from Africa. Here was data that the entire world needed, being generated by scientists who stayed in Johannesburg rather than moving to Geneva or London or Atlanta. The global health establishment had to reckon with what this meant. It meant that capacity matters more than charity, that building strong institutions in Africa isn't just about fairness or equity, it's about global security. That the next pandemic might be detected first in Lagos or Nairobi or Accra, and we'd better hope those cities have the labs and the scientists to recognize what they're seeing. It meant that travel bans punishing countries for detecting variants early are not just ethically wrong, they are strategically stupid. They incentivize hiding data rather than sharing it. They punish transparency and reward silence. It meant that Africa's scientific diaspora, the thousands of brilliant African scientists working in Western labs, represents a massive loss of capacity that weakens everyone's pandemic response. When those scientists stay in Africa and build institutions there, global health gets stronger, not weaker. Some learned these lessons, many still haven't. There's been some progress. The Africa CDC got increased funding and attention. More genomic surveillance networks launched across the continent. International partnerships became more reciprocal, more respectful. But the fundamental dynamics haven't changed as much as they should have. African scientists still struggle for funding. African research institutions still face skepticism that European or American institutions don't. African solutions still get less attention than Western ones. The scientists in South Africa know this. They are not naive about how the world works, but they also know what they proved. They know that excellence speaks for itself, that data doesn't lie, that results matter more than prejudice. And they know they are not alone. Across Africa, scientists are building capacity in genomics, virology, immunology, and epidemiology. The South African network is one example, but it's part of a larger movement. a continent deciding that it will no longer accept being left behind in science and innovation. Nigeria's genomic surveillance network detected variants independently. Kenya's research institutions contributed crucial data on malaria and HIV. Ghana's scientists are pioneering new approaches to vaccine development. Rwanda's healthcare system innovations are being studied globally. Africa's scientific renaissance is happening. COVID-19 didn't cause it. The seeds were planted years earlier, but the pandemic made it impossible to ignore. The question now is whether the rest of the world will support this transformation or resist it. Whether funding agencies will invest in African-led research at the scale it deserves. Whether journals will publish African scientists' work without demanding European or American co-authors to give it credibility. Whether international scientific collaborations will treat African partners as equals, not assistants. The scientists in South Africa aren't waiting for answers to these questions. They are already working on the next challenge, building the next innovation, training the next generation. Because that's what they've always done. That's what they'll keep doing. They refuse to wait for the world to notice them. They made themselves impossible to ignore.
December 2025, 4 years after Omicron. The genomic surveillance network that detected Omicron is now detecting far more than COVID variants. The infrastructure built for the pandemic has expanded into a comprehensive infectious disease monitoring system. Labs across South Africa and increasingly across Africa are using the same techniques to track influenza, RSV, tuberculosis, and emerging pathogens that haven't made headlines yet but could. This was always the plan. COVID was urgent, but the vision was always bigger. Dr. De Oliveira is now leading efforts to extend the network beyond South Africa's borders. Labs in Mozambique, Zimbabwe, and Botswana are joining the system. Training programs are bringing in scientists from across the continent. The network that proved itself with Omicron is becoming a continental asset. Professor Penny Moore's research has evolved too. She's studying not just how viruses escape immunity, but how African genetic diversity affects immune responses. Work that has implications for vaccine development worldwide. For too long, vaccines were designed based on data from European and North American populations. Moore's research is showing why that's insufficient, why African populations need to be central to vaccine research, not afterthoughts. Professor Pricer is working on something ambitious, a handheld genomic sequencer that can work in rural clinics without consistent electricity or internet. It sounds like science fiction, but it's nearly ready. Imagine detecting an outbreak in a remote village and having genomic data within hours, not weeks. That's what he's building. This is what investment in African science looks like when it's done right. Not one-time grants for specific diseases, but sustained support for infrastructure and talent. Not partnerships where African scientists are junior partners, but collaborations where they lead. The next generation is watching and joining. Universities in South Africa are seeing record applications for genomics and bioinformatics programs. Students who were in high school during COVID are now entering doctoral programs inspired by what they saw their country's scientists achieve. Many will stay in Africa. Not all. Some will take positions overseas, and that's okay. That's how science works. You go where the opportunities are. But increasingly, the opportunities are here. The labs are here. The cutting-edge research is here. The chance to work on problems that matter most urgently is here. This is how you build scientific capacity that lasts, by creating institutions worth staying for, by proving that world-class science happens in Johannesburg and Cape Town, not just in Cambridge and Stanford, by making sure the next pandemic's crucial discoveries might just as easily come from Lagos or Nairobi as from London or New York. The COVID surveillance network was proof of concept. Now comes the scaling. International health organizations are finally, slowly starting to understand. The WHO is investing more in African lab capacity. The US CDC has established partnerships that involve actual resource transfer, not just technical advice. European research funding is becoming slightly more accessible to African-led projects. It's not enough yet. It's never enough, but it's progress.
And the scientists who built the network that detected Omicron aren't waiting for enough. They're building with what they have, advocating for what they need, and proving every single day that investing in African science isn't charity, it's essential global health infrastructure. When the next pandemic comes, and it will come, the early detection might happen in Kinshasa or Dar es Salaam. The crucial data might come from labs in Addis Ababa or Accra. The scientists leading the response might have degrees from Makerere or Ibadan, not Harvard or Oxford. And the world will be safer because of it. Because disease doesn't respect borders or privilege. Because viruses mutate everywhere, not just in convenient locations for Western research. Because the only way to track global threats is to have global surveillance, and that means strong labs everywhere, especially in regions where new diseases often emerge. South Africa proved it's possible. Now the continent is proving it's scalable. This is what RISE looks like. Not one country, one breakthrough, one moment, but sustained investment in institutions and people. Infrastructure that outlasts emergencies, scientists who stay and build instead of leaving, young people choosing careers in science because they've seen what's possible. The scientists who detected Omicron are still working, still sequencing, still sharing data, still training the next generation, still refusing to accept that Africa will be anything less than a global leader in pandemic preparedness and response. They built something remarkable. Now they are building something even bigger. The world is starting to notice, but more importantly, Africa is noticing. Young people across the continent are seeing that they don't have to leave to do important science, that they can build institutions that matter globally while staying home. That's how you change everything. One lab, one network, one generation at a time. This is what Rise of African Nations is about. Stories like this one. Stories that show African excellence, African innovation, African solutions to global problems. Stories that have been ignored or underreported or attributed to others. The scientists who detected Omicron didn't do it for recognition. They did it because it needed to be done. Because someone had to build the infrastructure that Africa needed, and they refused to wait for someone else to do it. But their story deserves to be told, not as a feel-good exception, but as part of a larger pattern of African scientific achievement that the world has overlooked for too long. This channel exists to tell these stories, to rewrite the narratives that erased African contributions, to showcase the brilliance that has always been here, waiting for someone to pay attention. If this story inspired you, if it taught you something, if it made you see Africa differently, that's exactly what we're here to do. Like this video if you want more stories like this. Comment and let us know what African achievement you want to hear about next. Subscribe so you don't miss the next episode, because there are hundreds more stories like this one and we're just getting started. Read the full blog post in the description, and most importantly, subscribe and show your support. This channel runs on your engagement. Every view, every like, every share helps us create more content, helps us research deeper, helps us tell the stories that mainstream media ignores. Africa's rise isn't coming, it's here. It's been here. We're just making sure the world finally sees it. Subscribe now. Be part of this movement. Help us tell the stories that matter. This is Rise of African Nations, and we're just getting started.